So, here's a big question. What if we could predict a fatal heart event before it ever happens? Today, we're going to become clinical detectives and go on an investigation to uncover the hidden clues that can help prevent sudden cardiac death.
This is really the central mystery we're tackling. Think of it like a detective story, right? The clues to a potential catastrophe are hidden. They're in a patient's history, in their genetics, and in the really subtle signals their own heart is sending out. Our job is to find and interpret those clues before it's too late.
All right, first things first, let's be crystal clear on what we're investigating. Sudden cardiac death is not the same as a heart attack. A heart attack, that's a plumbing problem, a blocked pipe. SCD, on the other hand, is an electrical problem. It's this incredibly rapid, catastrophic event that's caused by a chaotic heart rhythm, something like ventricular fibrillation, where the heart just quivers instead of pumping. And that, of course, stops blood flow almost instantly.
So, where does our investigation begin? Well, exactly where any good doctor would start, by digging into the patient's background and looking at their family tree. You know, the past often holds the key to the future.
The number one cause of sudden cardiac death in adults is coronary artery disease, and the risk factors you see here, things like smoking, high blood pressure, a sedentary lifestyle, they probably look pretty familiar. They all contribute to that slow, steady buildup of plaque in the arteries.
And here's a really critical insight. The risk isn't just additive, it's multiplicative. Having several of these risk factors doesn't just add to your danger, it multiplies it. So a diabetic person who smokes and has high blood pressure isn't just facing 3 units of risk. No. The danger grows exponentially. It just skyrockets.
Okay, the next huge clue is in your genes. A family history of sudden, unexplained death, especially if it happened to someone young, is a massive red flag. It points toward inherited conditions, kind of like faulty wiring, if you will, that can predispose an entire family line to these awful events.
So what's the bottom line here? You just can't ignore this piece of history. It absolutely demands a thorough investigation. It's a clue that has to be chased down until you can say for sure that there's no inherited danger.
All right, so we've gathered clues from the past. Now, let's tune in and decode the active signals the heart is sending out right now, both the electrical ones and the mechanical ones.
When the heart muscle is starved of blood and oxygen, a condition called ischemia, it's not just about causing chest pain. That oxygen-starved muscle becomes electrically unstable. It gets irritable. It's basically fertile ground for a fatal arrhythmia to spark up and just take over.
You know, the simple electrocardiogram, or ECG, is an incredibly powerful detective tool. It gives us this little snapshot of the heart's electrical activity. On it, we can see scars from an old heart attack, or we can find clues to inherited electrical problems like long QT syndrome, where the heart takes too long to recharge, or Brugada syndrome, which can cause these terrifyingly fast rhythms. Okay, so next up, we use sound waves to look at the heart's physical structure. An echocardiogram can show us if the heart's chambers are getting stretched out and dilated, or if the muscle wall has become dangerously thick. Any of this physical remodeling can seriously mess with the heart's normal electrical pathways. Now this slide, this shows one of our absolute strongest predictors, the ejection fraction, or EF. All it is the percentage of blood the heart pumps out with each beat. A healthy heart is over 50%. But just look at the graph. See how the risk level just goes through the roof once that number drops below 35%? That is the danger zone. So a low ejection fraction is really a dual threat. It's a double whammy. It's telling us 2 things at once. Not only is the heart a weak pump, but the damaged muscle that's causing that weakness is also electrically unstable and just prone to short-circuiting.
But what if the dangerous rhythms are, playing hide and seek? A standard ECG only captures about 10 seconds of what's going on. A Holter monitor is a portable ECG that you wear for 24 hours or even longer, and it lets us catch those dangerous but sneaky beats that might be the trigger for a much bigger event.
Okay, for our final act, let's bring in the heavy hitters. These are the advanced tools that let us look beyond the immediate signals and actually analyze the heart's own blueprint for any hidden risks.
This is such a critical question in our investigation. I mean, a lot of victims of sudden cardiac death actually have a normal pumping function. So if the EF is fine, where's the hidden risk coming from? It's a real head-scratcher.
And so often, the answer is hiding right here, in scar tissue, or what we call fibrosis. A cardiac MRI can see the scarring in incredible detail. This scar tissue, it doesn't contract, and it messes up the flow of electricity. creating the perfect setup for deadly electrical circuits to form, even in a heart that otherwise seems totally strong. And this is the absolute key takeaway. That scar tissue, that fibrosis, it is the problem. It's the physical thing, the actual substrate where these lethal arrhythmias can start. You can think of it as the faulty wiring board for the heart.
And for those cases where we suspect an inherited problem, like the ones we talked about earlier, well, genetic testing can give us the ultimate diagnostic clue. It can pinpoint the specific gene mutation responsible, and then let us screen other family members who might be silently carrying that exact same risk.
So our whole investigation really comes together in a clear pathway. It's not random, it's a systematic process. We start with the patient's history. We decode the heart's electrical signals, we get an image of its physical structure, and finally, we analyze its genetic blueprint. Each step builds on the last to create a really complete picture of a person's risk.
Ultimately, this whole investigation shows us that sudden cardiac death, while it is catastrophic, is often not a complete surprise out of the blue. The heart gives warnings in a person's family history, on an ECG, or as hidden scars that are visible on an MRI. Our mission is to learn how to listen to those warnings before it's too late.